Yahoo! Hello. Oh my gosh, we have more people than usual on YouTube. Hmm. Wait, you guys are gonna have to tell me if you prefer like on YouTube, if you prefer your at usernames or your the ones that I see here, your actual usernames. Because I see Ricardo, good morning. Seth got first like on the stream. Well, thank you. You probably are the first like on the stream, I'm gonna be honest. Hi Lev, hi Sucho. Let me turn on my light. Oh. You know, I think it would be fun someday to like actually have a what's it called? Like a multi-chat situation. So I could have both YouTube and uh both YouTube and Twitch chat on screen. Clearly my coffee hasn't hit me yet. How are you guys? Hmm? Good morning, Lev. I hope your day and stream are amazing. Thank you, Akko. Akko, Akko, Akko. Okay. All right. I'm being whacked. I'm being whacked. Good morning, Lev. I loved your collab the other day. Oh, Azulotes, it means so much that you're like still come and check out my streams. I appreciate it. I'm so glad. Yeah, no, Saiken is so funny. He is so funny. And honestly, I like really look up to him as someone who like also does a lot of what's it called? Someone who also does a lot of like medical education, you know, but like also tries to make it fun. I don't know. I just like really appreciate how he incorporates his professional life into this stuff because I don't know. I try to do the same thing where it's like I'm a whole person, right? Like I am a doctor in my day life and that's not going to go away, but at the same time I'm more than just that. Like I'm also, you know, at times perhaps silly, not the most professional. Your voice is so soothing. I keep coming back. Oh, thank you. Your rig is so pretty. Zwilla, thank you. Oh my gosh. Yeah, the rig. So the art is done by Shibuya or Ranfa underscore oh 01. Oh my gosh, she did such a good job. It was from a while ago because she's so fast. She like finished the art in like a month. It's crazy. And then the rig is done by Cloudy Fair underscore 999. She's on VGen. She does such a good job. Yeah. She did such a great job. I'm so happy with the rig, honestly. Yeah, 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 yeah. And she gave me such fun toggles and stuff. Yeah. Confrontation 101. Are we doing the real life or online version? Just like generally speaking. Just generally speaking. Confrontation, communication, how to talk to someone when you're not in full agreement. They did fabulous. I love the cherry blossom details. Yes. Oh, okay. So in terms of like if you're talking about like the design, oh, that's a whole other thing. Um in that for all the process of getting to this visual design took a while because I have infinite greed. My greed is infinite and I really wanted to have a design that incorporated like too many things, if I'm gonna be honest. But it started with a adopt from Himsmoon, HIEMSMOON, Himsmoon. Um, she does a lot of like character design adopts, and she had one that was like so gorge. Like, um, well, I mean, you can see it. It's basically this design, right, with the sort of like Asian dress and the horns and the floopy leaf things, leaf my ear wings. Um, yeah. Except that they had white hair, they didn't have a huadian, they didn't have glasses, but it was like a singing sort of design, right? I think she also had a tail and like a little dragon, which I ended up taking off. But someone else got that adopt first, actually. And so I was like, all right, well, I resigned myself to losing this auction. That's fine. I'll come up with something else. But then she came back to me in my inbox and was like, oh, actually, um, the person who had the design at first like doesn't want it anymore, or like um doesn't like wanted a refund or something. So I got it. It was meant to be. And then from there, I took that design and some other ideas, like concepts that I had that I liked, like the green hair and the ears and the huadian and the glasses and stuff. Oh, and a different color scheme, um, like green instead of. I think she was originally teal and not like this green. Um, and Clef on VGen did my first ref sheet, and then from there, the rest is history. Then I got the model done and the rig done, and yeah, it was meant to be, I think, because this is just stunning. Oh, thank you. Yeah, I mean, design is like pretty important, I think. Mm. It was pretty important to me, I think, to have like a relatively cohesive design. I don't know if she's like the most unique design in the world, but I think she's pretty. And it feels like me, Um, in as much as like there's a little bit of how do I put this? Maturity, I guess. Because I'm not a teenager if that wasn't already obvious. I am an adult married woman with a full-time job. So, and I feel like that represents this as I think like that represents me relatively well. Yeah. So it is. It was what made me click the vid. Oh, yeah. Okay, I'm glad. Yes, my what's it called? My plan is working. My evil plan of enticing people in with a pretty model. It's working. Okay. All right. I'm not. Ow. Jesus. When it feels like you, it feels right. Yeah, exactly. Like, I have a bunch of models actually at this point that I will probably continue to cycle through. Mm, actually, not even probably. I definitely will continue to cycle through. But for now, this feels the most like me. Yeah. Yeah. Your evil plan is stopped by the fact that your height is measured in apples. I don't know what you mean. My height is not measured in apples. And if my height is measured in apples, it's like 50 apples. I'm like 20 feet tall or something. Okay. I'm so tall. You've never met anyone this tall before in your life. Okay. We should probably get started soon, huh? Do we want to talk about conflict resolution? 8 to 16 feet. Yes, that's me. That is 50 apples tall. Yeah. 50 apples is 8 to 16 feet. Wait, how did you get that? Like, if an apple is 3 inches tall? What's the average size of an apple? 2 inches? 2 to 4? Because, let's see, two, two, 2 times 50 is 100 divided by 12 is, yeah, it's about 8. Because 8 times 12 is 96, correct? Yes. Giantess left model when? I feel like that would play into someone's like kinks. And I'd rather not do that, actually. I'd rather not. You know, crazy if true, but it will make you officially taller than 3 apples. I am already taller than 3 apples. Excuse you. I'm not here for the kinks. I'm here to support my Ushi. Well, that's good. Thank God. Thank God someone's here to support me in my time of need. Sorry, I'm like really quick looking at my one calm templates to see if I could put one on here that would have all of y'all. Because I think that would be, let's see. Hmm. Let's see, let's see, let's see. Testing. Ooh, okay. It actually did work. So then I can turn this off. Config. Off. Yes. Ooh. Okay, and I think YouTube chat should work too. Testing YouTube. Cool. Ooh, something new. Yeah, literally. I mean, always something new, right? With me. Wow, so cool. Thank you. I wonder how low it goes, though. That's my question. Like, does it go? Hmm. It does go lower. Okay. Interesting. Ow. Hi, sis. Whoa. 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 Hmm. Hmm. Very interesting. This is fun. Yes, it is fun, I think. Okay, alright. Now I'm being bonked. Because nobody loves me. I'm being bonked because nobody loves me. Alright. So, my question for you guys is Morning Love. Hi, Blue. Yep. Yep. What is happening? Good luck, doggy. See ya. Okay, bye. By the way, background music? Wait, the background music should be going. I can hear it. There. Is it working now? Sorry, I like I can hear it. Okay, you guys can hear it now? Okay, cool, good. Okay, good, thank God. Dirty Snowball, thank you for your first time chat. Hello. Hello. Alright. So. Wait, I'm curious. Let's see. Scuff Queen. Go away. It died way in the beginning of stream and I mentioned, but you skipped my message. Sorry. No, I think I saw you mention it, but then I looked at it and I was like, but it's working. I can see it. So, I don't know what happened. How do I do a poll? Okay, never mind. I guess we're not going to do a poll. So, guys, I have a question for you. Have you ever been in a situation where you need to talk to someone that you care about, like a friend or a family member or your boyfriend, girlfriend, partner, about a problem, but you're like, I don't know how to do that, and it seems uncomfortable to bring up something that is going to make someone else upset and is going to make me upset? So maybe I just don't say anything, actually, and then you don't say anything, and then you keep on not saying anything, and then of course because you haven't said anything, the problem doesn't resolve itself, so then it keeps happening, and then at some point it happens and you get so upset that you start saying shit from like resentment or anger that's like built up over time, and maybe you didn't really mean it, but then now you're having a fight because now you're angry. Yeah. Das happened to all of us, I think. It's definitely happened to me before. And it's not fun, right? And I feel like there's something to be said for thinking about conflicts that you have with someone else in a in a more calm setting, right? Like on your own, thinking to yourself, like, okay, what exactly is going on? How do I feel? What do I think is happening? And in a calm, not angry time, maybe bring up what's going on. The thing is, it's really hard, right? It's really, really, really hard to go from to intentionally introduce tension and conflict into an otherwise calm interaction, right? To be like, oh, my friend and I are just hanging out and everything is fine and we're both calm. Time to bring up the thing that's been bothering me. That's hard, right? So that's the goal for today, is to talk about like, how do we, let's come up with a structure or like a framework for how we do that so that it's less scary. Is it going to be perfect? No, it's never going to be perfect. Could this still also devolve into a horrible argument? Yes, but does it give you probably a better chance of actually being heard? Yeah, probably. It has happened more than I would like, which is more than once. Calcium compadre. Thank you for your first time chat on Twitch. It's happened more than I would like, which is more than once. Yep, this happened to me a lot. I feel like it's happened to everyone. Thank you for joining us over here on Twitch. I know that you were over on YouTube first. Okay, so would you guys want like visual aids, or is it good if I just talk? Or does no one have an opinion? No one has an opinion? Okay. Just yeah. Cool. Okay, so then in that case, I will just type my large section headings. So first, principle that I think is really important and I think can help you frame whatever conflict, tension, situation you have with someone else is like, okay, and this is important to remind yourself, right? Start from a stance of like, the conflict is the thing that we want to resolve, right? This, I care about you, I know you care about me, we care about this relationship, right? It is not me versus you, it is the two of us versus this problem, right? And maybe the problem is like that you guys don't have the same taste in things or the same patterns in things, or something makes you feel uncared for or whatever, right? But it's like, it's part of assuming best intent, right? It's, let's come up with an example, right? Your partner never does the dishes. Let's say, right? Your partner never does the dishes and it bothers the shit out of you, right? Like maybe it's your roommate. Your roommate never does the dishes. You're always the one who's doing the dishes, right? And you're like, can you fucking do the dishes? And there's so many like non-charitable ways of saying this, right? Are you lazy? Right? You never do the dishes. You're always making me do the dishes. You don't give a shit about me. You don't care about me. Like there's always different things that you can say, and all of them, even if it's how you feel, are just gonna make the other person feel defensive and they're not gonna hear you, right? So focus on the problem, which is it feels uneven, or it feels like I usually am the one who's doing the dishes, or I would like if you could do the dishes more, because then it would feel more equitable. Are there things that I'm doing that don't feel equitable? Like what, how do we, the larger problem is that we want to exist together in this apartment without tension, you know? Alamea, I'm working so I can't see, so I'm in podcast mode. Lol. Oh my goodness. One of my screens is going haywire with hearts for some reason. I don't know why. Why is OneCom throwing hearts at me? Komoto Hawk. Welcome. Thank you for joining the Sakubara army. Hope you enjoy your stay. No one's talking back to me, so I guess I'll just continue yapping into the void, which is my specialty, I will say. Okay, so in any case, it's not me versus you, it's the two of us versus the problem, you know? As part of focusing on the problem, it finally goes a long way, especially when you don't know the other person that well, to start with emphasizing, affirming what you value about the other person first, and listening to what they have to say. The follow sound is scary loud compared to you and the music, sorry. I turned it down. I don't know what's going on there. Like, there's something very weird happening where a audio source that doesn't actually exist in this OBS scene is triggering, and I don't know why. Like, I don't know why it's doing that. Wabungus. Wabungus. Among Us? Wabungus? Yeah. Indayo. Sorry. I'm sorry. I scared you guys. Anomaly explained to me what a C-section is. I'm scared for life? I mean, are you anticipating receiving a C-section? Because there's ways to avoid it. I just took a midterm exam. Oh my gosh. Well, congratulations on being done with that. Hopefully it went well and you don't have to do it again. Thank you for the check-in. But yes, exactly. Like, I feel like, yeah, when you're having a conflict, focusing on the problem, because then it sort of gives the other side, like, not the other side, it gives the other person more emotional room to be able to say, here's how we can solve this problem together, right? Because if it's more from a perspective of me versus you, then it becomes more of a perspective of like, who's gonna win? We're battling each other, we're arguing with each other, which makes it like really hard to have a productive conversation, right? And like, that isn't to say that you shouldn't talk about like, oh, my feelings are hurt or this or that or the other, but like, I feel like it's usually good to try to promote what's the word? Openness? Make it less likely for someone to feel defensive, right? Like, there's times when we argue with other people that if emotions get really, really high, that people will start saying things intentionally to hurt the other person, right? Like, at some point, it stops being like, we're having a disagreement that we need to fix, and it becomes like, I want to hurt your feelings to show you that you hurt me, or to get you back at you for hurting me, or something like that. Are you really a psychiatrist? Not trying to be rude. I am. I'm a fourth year psychiatry resident. I'm graduating in 3 months, and starting my like full-time. Well, I already have a full-time job as a resident. It's like a little different, but I'm graduating from training, like specialty training. But yeah. It's not rude at all. It's completely understandable. I mean, you can choose to not believe me, but that's awesome. Thank you. Sub Kitty? How would you like to be referred to? I see. I think your @ is like summer. Bro, YouTube's situation with usernames right now is like so confusing. Like, people have names that you can, like, channel names and stuff, but then it's not what gets displayed in chat, it's their like @ which the @ username is never what people actually want to be called, I think. I've ordered Domino's coming soon. Bro, now I want pizza. Don't say that to me, now I want pizza. Your voice is soothing. I think it's suitable for a doctor role. Thank you. Yes, I have trained my... Well, have I trained my voice? I think some of this is natural. I like have a kind of deeper voice for a woman, I think. Okay, I say I think. This is what I've been told, is my impression. Yeah, I feel like having a deeper voice makes it more likely that there's like there's a soothing quality to it, right? Even when you talk normally, I feel like if you have a really, really high voice, you have to go more soft and gentle. You have a very deep voice for 3 apples. Okay. But yes, okay. Problem over person. Lev, have you done any operations on anyone? So part of medical training in the United States, at least where I live, when you go to medical school, which I did before my psychiatry specific training, part of that is a year, 2 years of rotations, like clinical rotations in the hospital, hospitals associated with the school that you're at, right? And there's some core rotations that every medical student has to do, and one of them is OB-GYN, right? Obstetrics and gynecology. Obstetrics being like the pregnancy part, usually, of that specialty. And yeah, so I have, well, I guess we're talking about operations generally, but yeah, I've been present for and helped with C-sections, with births. I did do another core rotation is surgery. So every medical student in America has to do a surgery rotation, like a clinical surgery rotation. So I did mine in abdominal surgery, like various abdominal surgeries. So I've been present for lots of stuff. Lots of appendicitis and cholecystectomies and stuff. Those are like really, really common. I've seen like thyroid removals. I've seen some tumor removals. I think I've done some bariatric surgeries. Not by myself, obviously, but I've like helped with bariatric surgeries. The school that I went to, our clinical rotations were very hands-on. So let me think. I sutured a lot in terms of like actual clinical care during surgery. I did a lot of suturing, a lot of retracting, and a lot of like holding the camera. Oh, I think someone's headpad thing didn't happen. Has anyone passed away under your care? Don't need to answer that if you don't want to. So, I'm trying to think if anyone has ever passed away unexpectedly. I'm not sure, but yeah, no, as a student and as a doctor, I have had patients pass away, thankfully, never in a psychiatric capacity. Part of psychiatry training is doing, in your first year, a lot of non-psychiatry. So I, as an intern, which is what we call the first year of your specialty training, residency training, I did rotate through like medicine and some other rotations. And the units that I was on, a lot of them were more for people who had like really, really chronic cancer, those types of things. So I had patients who were on palliative or hospice care. Those are two different things, but they're similar enough for lay people. So like on end of life care. So they passed away, but it wasn't like unexpected. And it actually was like a very valuable experience. It's very interesting to be able to talk to people at that stage of their life, I think. And I feel like it's very meaningful to be able to help those patients and their families get through like an end of life process without like, and have it not be a surprise, I guess. I don't know. Being a hospital chaplain sounds so hard and depressing. I mean, I've talked to chaplains, yeah. I think their work is very dovetails well with psychiatry work. Do you also work with mental health? Yeah, that's my whole job. Yeah. So I'm a psychiatrist now. So my whole job is doing mental health. I do med management and therapy. I personally really love therapy, even though it's not something a lot of psychiatrists do, because it's not exclusive to psychiatrists, right? Or rather, not a lot of psychiatrists only do therapy, because it's just not exactly what we trained for. Like if you wanted to only do therapy, it would make way more sense to go get a PhD or a PsyD. But I enjoy managing meds, but I really love therapy. All right, we got really off topic. Oh, so you're like the one doing the diagnosing and stuff then, right? Yeah. Sorry, I'm not educated. No, you're good. Yeah. Okay, so briefly then. Okay, briefly, let's talk about the differences between different kinds of mental health providers, at least in the United States. So you have what I am, which is a psychiatrist. Psychiatrist typically refers to someone who has had medical training and is able to psychiatrist usually refers to someone who has medical training and is able to prescribe medications. So these are your MDs and your DOs, your doctor whatevers, right? There are what we call like APPs, advanced practice providers, I think, or practitioners, like physician's assistants and nurse practitioners who can also prescribe but have to be under the supervision of a physician often. So those are like people who can prescribe medications, right? And then you have psychologists, who are people who have extra education and training in therapy. So these are your PsyDs and your people with PhDs in psychology, and they mostly do therapy, but oftentimes if someone has had that extra education and training, they can also do a lot of assessments, like neurologic assessments, like psychiatric or neurologic testing. They can do structured interviews. They can do a lot more like diagnostic stuff that you do through talking and doing like tests and stuff. So like if you think about like intelligence tests and things like that, they're the ones who would be able to do that. And then you have like just the therapists generally. So all of the above can be therapists, but not, I think most of them don't. Most of people who have some advanced training don't tend to just do therapy, and you don't have to be a psychologist or a psychiatrist to do therapy. There's a lot of therapists that are licensed clinical social workers, so they have a social work degree and they do extra training, and they have a lot of like clinical experience. And they do therapy, so a lot of therapists are actually LCSWs. So that's the thing. What type of therapy will you do? I do all kinds of therapy because I enjoy doing eclectic therapy. So I do cognitive behavioral therapy. I personally really enjoy doing exposure therapies with patients, and then I really like a psychodynamic, like talk therapy, relational therapy. Oh, Valley Girl voice. Why are you making me talk in a Valley Girl voice? Like when I'm trying to talk about something serious. Oh my god. Oh my god. Any tips for overcoming PDA? Wait, PDA? You mean public displays of affection? Is that something that you need to overcome? Exposure therapy sounds like it requires a lot of patience. It requires patience and courage. Not necessarily from me, or just me. Pathological demand avoidance. I mean, I think it kind of depends on the specifics of your situation, and I'm going wait, I got distracted. Yeah, pathological demand avoidance. I'm not an expert in autism. Unfortunately, this is something that I think about a lot actually, is that a lot of things that we help to treat or manage, if they start in childhood, even if they continue into adulthood, it often becomes kind of the domain of like the child experts, right? So a lot of like genetic diseases, for example, that start when you're a baby but continue for the rest of your life. Those are often treated mostly by pediatricians, right? But then at some point you like age out of being a pediatrician. Anyways, all that is to say is that a lot of autism experts, ADHD experts, things like that are in the child psych realm, which is not what I'm trained in. Or at least I don't have the same amount of specialized training as someone who's done a child psychiatry fellowship. All that being said, with pathological demand avoidance, what I would think about, especially as an adult, oh yeah, like exactly what you're just saying, right? Is trying to listen to your body's needs, as simple as just going to pee when I first feel a need. Yeah, I think that's part of it, because I think like the way that I think about it is that part of what's going on is that it's kind of like sorry, you'll realize I like weird metaphors. It's kind of like oobleck. Like, you know when you mix cornstarch with water and you make that little like putty Play-Doh thing where the harder you hit it, the harder it is in resistance, right? But then if you, like a non-Newtonian whatever, right? So the harder you push, the harder it pushes back. That's how I sort of think about it. So then the solution then can't be to push harder, right? Like the heart, you can't force yourself out of like demand avoidance, right? Because the more demand there is, the more avoidance there is, right? So like Indeo said, like doing things before the demand escalates too much, I think is good. Oh, that's a big brain metaphor you just came up with. Thanks, Carbs. Ah, bro, I love a good metaphor. A penguin who kills. Thank you for your first time chat. I don't know what you mean by everyone favorite penguin. My favorite penguin is the one from Happy Feet. And no, Lev, you shouldn't stop. Shouldn't stop what? Oh, my weird metaphors? Oh yeah. Remember guys, Lev doesn't identify as a yapper. Yeah, I'm not a yapper. I don't talk that much. I just talk a normal amount. But yeah, that's what I sort of think about. Like, you gotta come at it sideways a little bit, right? Like, okay, you can't force yourself into it, so maybe like, I really need to pee. However, my brain is like, okay, well, I hate being forced to do anything. This fucking sucks. So find something else that maybe is like, oh, but maybe I'm a little bit hungry, or I kind of want to just like stand up and walk or something, you know? And maybe it gets you closer to the bathroom. But you know yourself best, right? It's like whatever actually like motivates you to do things that's sideways from the actual thing that you're demand avoiding. Thanks for the advice. It's a great metaphor. Oh, okay, I'm so glad. Okay. Principle 2. Use reflective listening. Okay? Use reflective listening. What I mean by this is listen to the person you are talking to. When we are in a conflict, a lot of the time, we stop listening to the other person, right? I don't know if this has ever happened to you, but have you ever been in an argument with someone or a disagreement with someone, and then you feel like they aren't hearing you? Like you feel like you just keep saying the same things and they keep saying the same things, and you're just like talking at each other, but like they don't hear you at all. They're just saying the same thing over and over again. Or it just feels like they're just trying to get their point across without hearing what you're trying to say, right? And vice versa. Have you ever... Music? Wait, what about music? Bro, seek. Okay, I don't know what you meant. Okay, there we go. I made it louder on purpose. Why? Why? Look, that scared the shit out of me. I'm sorry. I am sorry, but I'm also not that sorry. I'm a little bit sorry. I'm like 2% sorry. You gotta use your words. If you just say music, then I'm going to assume the music isn't loud enough. Okay? Ma'am, you have my attention. This is the face of someone who doesn't feel guilty at all. And she asks why we give her bad outcomes in Cult of the Lamb. I'm going to sacrifice you first next time. Greetings, it's your favorite government villain. Hello, tax lord. It is almost time to pay the tax man. So thank you for coming in and reminding us of that fact. Let me finish my point. Thank you. Asian Penguin is the only person who's listening to me. I find it helpful to start with what you think they said first. Like, what I heard you say was this. Is that right? Yes, exactly. Exactly. That's the reflective piece, like reflecting back to them what they're saying. In terms of helpful advice, like actionable advice and things to look out for when you're having a conversation with someone that's kind of a disagreement or a conflict, right? Watch out for listening to what they're saying only to try to make your own point, right? Like when the other person is talking, watch out for when you kind of are either like not listening because you're trying to make your own point, or you're only listening for things that you can respond to and trying to think of what you're going to be saying. You know? Because that's usually a sign that you're like not actually listening to what they're trying to say. When they're talking, it is helpful to try to hear where they're coming from and then reflect back to them what you think they're saying. And especially from perspective of like what they are saying that they feel, right? Like okay, you're saying that you feel blah, 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 blah because of me, right? Like using the example we were using before. You're talking to someone who's like your roommate is not doing the dishes and it really pisses you off, right? And maybe something they're saying is like, well, every single time I do the dishes, you tell me to do it wrong, you know? And you can reflect on that, right? Because maybe they're being angry and maybe it makes you feel a little bit defensive, but it's not helpful to start yelling back about how they don't know how to do anything, right? It's probably more helpful to say like, okay, I hear that like feels like I am giving you too much pressure, or I'm being picky, or that it sounds like you feel like there's no point in doing it because I'm going to yell at you. Is that right? You know? Listen to understand rather than to respond. Yes, exactly. Listen to understand rather than to respond. Right? Because the goal of a conflict resolution, of an argument, I guess, is not... 1141 Indayo. Thank you for the follow on Twitch. Thank you for coming over from YouTube. Because the goal of a conflict resolving conversation, right, is not to say there's this problem and it's your fault or it's my fault. The goal is to solve the problem, right? And often problems are co-created by two people. Not intentionally. Right? Not intentionally. But in like a relationship where you're like, we're friends, we're lovers, we're whatever, we care about each other. Like, no one's trying to hurt each other on purpose. Can you please speak slow because my English is not good? Okay, I will try to speak slower. Thank you for asking. Going back in the comments a little bit, you said something in, is that Russian? That's Cyrillic, right? I don't have a translator. Let's see. Привет. Hello. I do not know that much Russian. It's Russian, I said hello. I don't know that much Russian. I know a little bit because also for a variety of reasons, because my grandmother grew up in a part that was, I don't know how to say, managed by the USSR. Or rather, my grandparents grew up in communist China, so a lot of them learned Russian, and I, for better or for worse, had a very classical, like, Russian ballet and Russian piano learning situation. Yes. So, lots of banging staffs on the ground. Louis 9947. No. It's your first time chat, so I'm not going to be like mean or anything, but that's not the vibe here. It's okay, XD. I know, unfortunately, I really want to learn more languages. This is a secondary thing. Anyways, A-Pop says, I found that as I've centered my communication around needs, especially around shared needs, I've come away from conversations feeling it went productively. Yeah, no, I completely agree. Exactly, right? It's like, this is like a combination of the first and second points, right? The first point being focus on the problem, not the person, and the second point being like reflect and actually listen to understand, not to respond, right? Because like, if you center it around like, okay, this is a problem that we're both trying to solve together. This is a problem we're both trying to solve because we have shared needs. We both want all the dishes to be clean without either of us being upset about it, right? I think that helps much more than like a blame game, you know? What a wild first time chat. Yeah, it is a pretty wild first time chat. Are you his mother? No. I am not his mother. I think that's part of why it's weird. It's part of why I'm also confused. Yeah. I don't know if this is something you need explain. I don't get it. Oh, which part? The mother part? How are you doing today? I'm good, Vanny. Not trying to trauma dump, but I grew up in a toxic household and now I struggle to interact with people normally. I guess, and have a lot of anxiety. I feel stuck socially. That makes sense. I mean, from a developmental sort of perspective, right? Like, the environment and circumstances that we grow up in shape how our minds subconsciously and unconsciously see the world, and the expectations that we have about the world and about how other people are going to treat us and how other people are going to react to us, right? And the things that we learn to do as a child as we grow up in order to survive, like not even physically survive, like emotionally survive the setting that we grow up in, while they might have helped to some degree when you're younger, oftentimes the world at large, like the world that you enter as an adult, is going to be different from the world that you grew up in as a child. So the things that helped you to survive as a child and the things that you learned about how people are, and the assumptions that you learned about how people will react to you, how people will respond to you, those things don't always transfer to interacting with the world generally, right? And that's often a big part of what leads to problems. Right? Like, let's say you grow up in a household where no one says anything directly, right? The expectation is that you hear, like, it's a more passive form of communication, right? Let's say you grow up in a household where no one does direct confrontation and says, this made me upset, I don't like this, or whatever, right? Or the only time direct confrontation happens is when people are angry. That teaches you a lot of things about whether confrontation is quote unquote good or quote unquote bad. It teaches you a lot of things about what is acceptable to say, what is not acceptable to say, and it can make you maybe have issues in the future, right? Like if someone else maybe grew up in a household where everyone was very, very direct, it could lead to problems where someone's trying to communicate clearly about what they need, and then on the other side it feels like, oh, I guess you hate me. I have a question. Rishi. Do you prefer Rishi? Rishi? Rish? Rish? Whoop. Go for it. Ask me your question. Feelings? Haven't had those for years. Okay. You might not consciously be as aware of them, but they're definitely there. You know what the best part of being a VTuber is? I can like scratch my nose and no one will know. Yes, Rishi, what is your question? What is your question? Ask your question. I will try to answer your question, and then we will move on to point 3. In the meantime, I'm going to make faces at the camera. How to make people less intimidated of me? Ooh, that is an interesting question. Why are you worried about scratching your nose? No, I just don't want anyone to see. Well, Rishi, I guess it depends on why people are intimidated of you, because it can be for a variety of different reasons. I'm gonna guess, actually, like, are you currently in a area, like, are you an immigrant? Or because sometimes stuff like that happens with like culture clash. Good old I statements. Yep, I enjoyed them very much because vulnerability is a good avenue for people to open up. Yes. Because I'm large. Oh. You know, I think so here's the thing. I think on some level, if there are some people who are just naturally more intimidating, right? Like a really, really tall, broad, large person is going to be more intimidating than a very, very small person. Just generally, I think, inherently, right? Yeah, and so like I don't know that it's possible. I am 6'4". Yeah, that's tall. I don't know that it's possible to become 0% intimidating, right? Yeah, you can't be not intimidating. People are always going to be a little bit intimidated, but I think being aware of how you might come off, and being considerate, I think does goes a long way, right? In America, at least, I think smiling, being friendly, um, helps a lot. Yeah. Yeah, and this goes along with something else that I think about a lot, which is like getting to know yourself and your natural tendencies, both in terms of the way that you tend to think, but also in the way that you tend to be perceived by other people, right? Like, this might be for, this might actually also, as often, unfortunately, is also related to like biases and stereotypes. Like, for example, a small woman is just always, unfortunately, going to come off like skewed, kind of um, deferential and anxious, right? So that's just something to be aware of, right? Is that like you saying something, like someone who has a more physically intimidating presence, I guess, you saying the same thing on the same tone as someone else is going to come off a little bit differently. And so that means that maybe you need to skew what you say and how you present yourself a little bit more like warm and fuzzy, which is unfortunate. And it sucks to have to do that. Living in India for medical studies. I see. Well, in that case, it also could be. I have not been to India, but having been to South Asia generally and Southeast Asia and East Asia, not that they're the same at all, but I think that yeah, I think how do I put this? I think that being a foreigner also can make people feel like kind of uh unsure of how best to interact with you, which can seem like they're intimidated. Mm-hmm. Okay, 1141 Indeo. Also, what do you want to be called? Because I don't know if I can keep calling you that. That feels rude. I gotta ask, doesn't it become straining to hear people here talk about these heavy topics? I understand it is your job too. How do you manage? This is a very good question. I agree with Seek. Yeah, I feel like my name is Anna. Okay. Anna or Anna? Let's see. Okay. Anna. Yay, I like knowing people's names. I think it's important. Well, it's twofold, I think. One part is that you kind of get used to it, right? I spend a lot of time thinking about these things, and it's not that you get desensitized, I think. I think it just becomes less distressing to think about, right? In the same way that, like, the first time you go swimming in a public swimming pool, you're like, oh my god, it's freaking cold, right? You're like, oh my god, it's so cold, and I need to like dip my toe in, and then my foot in, and then my legs, and then oh my god, I'm going up to my chest, and I'm so cold, and it's like I hate it, right? And it takes so long to get used to it, and it's so jarring, and all these things. And I don't know that every single time you get back in the pool, it necessarily becomes like less jarring. It's still like, oh my god, it's fucking cold. But by doing it many times, you sort of get used to that feeling, and you also learn, like, oh, okay, this is fine, like I'll get used to it. Like the process of it is, it becomes more familiar, right? It becomes easier and more I don't want to say reassuring, but like you have some faith that you'll survive, right? And that like, oh, okay, I can handle this, right? And over time, like what you can handle and what you can tolerate just increases. It's like building a muscle. So that's one part. The other part is just like learning to have a better sense of my own boundaries and being able to say like, no, we're not talking about that. That's all. You know? Like, I feel like, and this is kind of what we're talking about today too, right? Like confrontation or disagreement doesn't have to be like a huge big thing, and it gets less scary the more that you do it. So yeah, like there are times when people have asked things that would cross the line for me personally. Or we start talking about things where I'm like, that's not, right? And it doesn't, I don't know, like, I understand that people want to connect and people want to have their problems heard, but then there's times where I'm just like, I just can't answer that, you know? And you can do it in a nice way, and that's it. Yeah. You get used to it. I think it also helps that thinking about like the meaning of life. What does it mean to live a good life? What does it mean to be happy? These are all things that have always been interesting to me, so I like talking about them. And I love my job, so maybe I'm different because I'm autistic. My threshold doesn't move up, I just become more stressed. Well, that's fair. And that's a good thing to know about yourself. Yeah. Now I want to try cheeseburger. Now I want a cheeseburger, but I'm lactose intolerant. You can't do this to me. I have a question to ask about a specific topic, but I don't know if it's relevant to the topic. I mean, you can ask. Right now we're in a question and answer portion, I suppose, before I get back to the rest of my plan. Why are we projectiling? Wait, what do you mean? You mean the chat? You won't believe I'm using this app to make my English better. No, it makes a lot of sense. Yeah. No, you guys can ask your questions. If I can't answer them, I'll just say so. Oh. There we go. Okay. By the way, there's a giveaway for a signed print that's going on this week. So, up to you guys. You don't have to do it, but if you've already entered, then you're already in there. Yeah. Questions. Miss Ma'am. This past weekend, I confronted my ex-boyfriend about cheating. I feel very proud because I navigated the conversation to a point of gotcha and then I revealed what I knew. Good for you. I'm glad you did it. The hydration reminder. It is pretty fun to do. To spray me in the face. Yes. Thank you for continuing to spray me in the face. Okay. We have a lot of questions. Okay, one question from Derp1523. Let me know if you would like to be called something else besides Derp. How does someone such as myself overcome the social fear of being perceived as a creep? Ooh. That's very specific. And the reason I'm pausing is because it's kind of hard to say. Like, derp is more than okay. Okay. Um, oh my god. Okay, alright. I guess I'm gonna be sprayed for the rest of my life. Thank you, Freezer. I also can't see anything on screen because of the chat. Just, okay. This is great. Thank you so much. What is the definition of a creep? Yeah, I mean, that's also part of it, right? Okay, I think there's two parts to it. I think one part of this thing is accepting that there's always going to be a possibility that someone is going to think that you're a creep. It's gonna happen, you know? Don't force anything, assuming this is about romantic creepiness. Yeah, bae, I agree. Okay, alright. You guys are clogging my chat. I can't fucking see anything. Okay. Okay, I'm about to turn off the hydration redeem. Thank you, Rosie, for being a mod. Are you hydrated, Lev? You know, I think so. You know, I think I'm wet. Oh, blink twice if no? Okay, I guess I just won't blink then. Anyways. Okay, so there's two parts to it. One is accept that it is entirely possible you will be seen as a creep. It's gonna happen. At some point. I've probably been, I have a similar fear of being perceived as annoying. People have definitely found me annoying. I bet people have come into this chat and been like, wow, this girl is fucking weird, and then left. And that's fine. You know? Okay. All right. Right. And then the other part of it is just like, I'm curious where the fear of being a creep comes from. Like, is there a particular thing that you're afraid of? Because like a fear of rejection, or not being perceived correctly, you know? Oh my goodness. All right, well, I got a cell phone in my face. That's great. It does come from a specific place. How does one get in touch with their feelings more when it's already hard to be consciously aware of them? That is hard. Basically, you have to make an effort. I think right now, in our current day and age, it's very easy to distract ourselves with input, right? With like watching things, talking to people, consuming things, and to get in touch with your own emotions, if it's not something that you've practiced, then you need to practice it, and that involves being with yourself, right? So like journaling and things like that, right? Journaling, sit down, what am I feeling? What am I feeling in my body? This, that, you know, that sort of a thing. Like, give yourself like time to sit with yourself and sit with your brain and sit with your body and think like, what am I feeling right now? And see where that takes you. Like free association, free flowing journaling, that sort of a thing. Like, that is what usually tends to work. Rosie, I got to your question. I've been scrolling. Okay, so my friend made me a godparent. I'm terrified now about the baby. What is the psychology behind parenting and single parenthood? Wait, what do you mean by what is the psychology behind parenting and single parenthood? Like how do you be a single parent? Or like how do you survive being a single parent? Are you Oh, endearing. It's like something endearing usually refers to a aspect of a person or a behavior or something that makes you like someone more. And often it implies, like the underlying meaning is that it's often something that other people might usually find like weird or annoying. You know? Like a kitten, 그tonyo. The management and stuff. Gotta be Lev psychology. Like Lev wants to strangle us because we are so endearing. Yeah. Like chat finds the fact that I get angry endearing, which is why they keep trying to make me angry. Oh, Derp, thank you for the follow. So, I mean, okay, so the things that I can say about parenting, just off the top of my head. Well, there's definitely a lot of really good parenting books out there. I feel like one big psychological factor is like that you want to spare your child pain and you don't want them to experience the struggles that you've experienced. And unfortunately, they kind of have to, right? I feel like that's where a lot of like well-intentioned parents get into the quote-unquote using their kid to fulfill their own dreams, right? Sometimes it's not even that. It's more like, I never got the opportunity to do XYZ. I never got the opportunity to go to college. I would have killed for the opportunity to go to college. So now I want to give you the opportunity to go to college. And sometimes that can get twisted into like, you have to do this thing that I wasn't able to do, which isn't always what people mean, you know? I got this. Woo! Oh my gosh, that's so cute. Live through the kid. Right, yeah, exactly. And I think it's helpful to try to take kids where they're at, because they don't have the experiences that we have. They don't have the complexity of thought that we're able to have, and so they can't like think their way through problems the way that we can. So it's going to happen a lot where like sometimes the only way to learn something is to experience the mistake, right? Gotta let your kids fall, you gotta let your kids make their own mistakes, like you gotta let your kids learn consequences, but it's about always being a support and always being there for them, right? It's like, yeah, you're gonna hurt your knee, you're gonna fall over, you're gonna get cuts, you're gonna get bruised, but I will always be there. Yeah. It's 1 a.m. now here, and good night, good man. All right, good night. Thank you so much for being here. So that's what I think about parenting. Oh, I love kids. I love spending time with kids. I was spending time with a little baby recently. Not a baby. Like, I think they're like three or four. And the thing with kids is like you just have to show a lot of interest in them and show a lot of interest in their internal experience and their emotions. Like kids love when you pretend not to know things and let them teach you. They love when you overreact. Like I think I was very lucky. I had some I've had a lot of experience with kids, basically. Okay, I'm quitting smoking for this. Oh my gosh, congratulations. That's really, that's impressive and worth being proud of. Denzel Samuel Purantoro. Hello. Hi. Ooh, how do you stop from getting emotional, like angry during confrontations? As a sensitive person, this is so difficult for me. This is very hard. I mean, it depends. It kind of depends on where the anger is coming from. And I think that's a big part of it, right? Is that if you can figure out what is making you angry. And so this is the next part. Let's see. Because my pinned chat went away. Third principle, use I statements. Okay, we're going back to the topic at hand. Okay, we're going back to the topic at hand. Let's talk about using I statements because it's related to this. So, Bae, my thinking is, okay, this is how I think about it. We cannot, maybe some other psych people would disagree with me. This is how I feel. I feel like we can't control our own emotional reactions to things necessarily, right? In the same way that we can't control like pain, right? Because a lot of times like negative, like if you really abstract it down, right, emotion is often just very specific forms of emotional pain or emotional pleasure, right? And in the same way that we can't control if we feel hungry or not, we can't control if a bruise hurts, we can't control if, you know, our, like, I don't know, having sex feels good, like things that feel good, like we can't control these things necessarily, right? The feeling is not something we can control. What we can control is how we express it and how we behave, right? Like, I can't control if something makes me angry, like on the road, for example. If someone cuts me off and that pisses me off, I can't control that it pissed me off. I can control that I'm not going to like crash into the person who cut me off, right? And so that's where I think the difference is, right? It's not, I think the goal maybe isn't, I think the goal isn't, I don't want to get angry, right? I think the goal maybe is more, I don't want to behave in a way that's going to be hurtful or that I'm going to regret later. And being angry makes it more likely that might happen. But I personally think that the tie between like I'm angry and now I'm going to like hurt someone else or whatever is not necessarily, that's not the part that you can't control. You know what I mean? I'm gonna give another example. Like I feel like a lot of the time the motivation, right, is, oh, I got really angry and then I told this person that I hate them and I hope they die, you know? and you're like, oh God. And then afterwards, you're like clear-headed. You're like, oh my God, I can't believe I said that. Like, what the fuck, right? What's wrong with me? I can't get angry. And I think instead of that, it's more like, okay, I got really, 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 really angry. And that made me say something I wouldn't normally say. That's a sign of how angry I was. That's the part that I need to target, right? I like that reframing. I'm going to try and view it from this angle. Yeah. Yeah. And so that's where I statements come in, right? It's when sharing your concern or your emotion, begin your sentence with I, or I feel, I think that, it makes me feel, whatever. It sort of shows like, okay, this is the emotion that I'm feeling. It's not saying that you made me feel this way or this is your fault, but it helps to express where you're coming from, right? Like, I feel betrayed when you don't listen to me or something, right? I feel like you're not listening to me and it's making me upset. That's often more effective than you never listen to me, right? So you statements are often not helpful. You blah, 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 blah. And then never and always are also usually not helpful statements when you're in the middle of a conflict resolution, right? Hey, Lev, got a question about the listen to the other person to the listening to yourself things. Yes, you can ask that question. Ghostface, thank you so much for the chat. That's very sweet. And this is your first time chat too. Thank you so much. It means more than you. Oh. Wait, have you been a lurker here before? That's actually really sweet. Thank you so much. How do you notice when the partner is only focusing on their arguments instead of listening, and can you stop them from doing it? So, well, I mean, I feel like it's something that you will feel, right? Like, and this is where practicing these things all kind of reinforce each other, right? Where you can say, like you can notice, oh, I'm starting to feel really frustrated and annoyed and angry or whatever. That's how I would feel if I felt like someone wasn't listening to me, right? And that's something that you can say, like, hey, right now, and it's not you're not listening to me or you never listen to me. Those are defensive statements that are going to make someone feel defensive. But I statements feel like you're not listening to me. Yeah. I feel like you're not listening to what I'm saying. That makes me feel hurt. Maybe going into like other things like reflective listening. I hear that you're really angry and I think that maybe it's making it hard to hear what I'm trying to say. I don't want to make you more angry or make you more upset, or I don't feel like you're listening and I feel like it's making it hard for us to solve this problem, right? You can put all of them together. You can't stop another person from doing anything, right? And this isn't to say this is like the right way to do conflict resolution and that like if you do this you're better than the other person that you're talking to. It's just, you know, the goal is to resolve the conflict. This is also helpful, thank you. Oh, you're welcome. I'm really glad. I see quite some people criticizing using therapy speech in non-therapy settings, like between friends. I'm curious, how do you see that? I feel like more than therapy speech. Okay, there's multiple parts to this. More than therapy speech, I feel like there's too much like diagnosis speech, right? Like you're narcissistic or this person is toxic or I don't have the emotional band, like that sort of a thing. And then I also feel like people don't go far, people don't take the next step after validation, right? Like, I think there's a difference between something being valid and something being helpful or productive, right? I think that it's possible, if not very likely, for something to be both valid and non-productive, right? And so that's the problem. I think that in our someone being like, you're being manipulative while they themselves are being manipulative. Or saying to someone else, yeah. Well, again, it's like once you start putting people into a blame game and trying to say like who's right and who's wrong, I feel like that's the real problem. Yeah. If I could put it simply, I think that there is often a perspective of like, someone has to be right and someone has to be wrong. There's a right way to feel about this and there's a wrong way to feel about this. There's a way that you're allowed to feel about this. There's a way you're not allowed to feel about this. And then even beyond that, there's this idea of like, if this is a valid reaction for me to have, then you can't criticize me for it, or you can't be hurt by my reaction, or I don't need to change how I respond, right? Like, and those things are all different, in my opinion, right? Like, somebody forgetting to say happy birthday could make you angry, and that anger is reasonable, right? That doesn't mean that every action you take because of that anger is reasonable. Those are two different things. And it also doesn't mean that like other person is a bad person. People forget. I feel like we have expectations that how do I put this? I feel like we have this expectation that relationships are meant to be relationships are meant to be perfect somehow. That because something, how do I put this? I guess what I see a lot of is like they should have known that this would have hurt my feelings, so they shouldn't have done it in the first place, or something like that, you know? Okay. I feel like people are moving on a little bit, which is okay. Chloe asks, here's an interesting one. How do you become more confrontational when necessary, when you can't stand conflict and would rather be as far away from conflict as possible, mainly from fear of what may result from it? Yes, I'm also a very non-confrontational person at baseline. Yeah. My natural state is very non-confrontational. But over time, I guess the way that I would recommend is start with recognizing when you are in conflict with people. Because I think that's the hard part. For a lot of us who are very non-confrontational, it becomes so much a part of your identity that you maybe even have trouble recognizing when you are in disagreement with someone or when someone does make you upset, right? This happened to me a lot, is that I wouldn't realize that I was like upset with someone or didn't like what someone said because I was so non-confrontational at the time that like I was never going to say anything, right? And so since I was never going to say anything, I think my brain was just like don't even perceive your own upset. And so that was, for me, I think, the starting point, right? It's like, okay, when am I upset with people? I just need to know that. Like, when am I getting, like, annoyed? When am I getting, like, a little bit frustrated? Like, before it gets to the point of I'm exploding and crying and feeling like nobody cares about me anymore. Because if you let it go on for too long, that's what it will become, right? It's the little bit of like, oh, that was a little bit annoying. Like, letting yourself feel that, I think, is the first step. And then beginning to express it a little bit. Because it doesn't have to be, because the thing is that when you are very non-confrontational, that means that the only confrontations you have are big bad ones, because they're the really, really big, important, unignorable confrontations, right? Like, if you're really, really non-confrontational, all the small things that you could use to practice, you usually will let slide, right? Like, oh, I really would have rather gone to Olive Garden instead of Wendy's, right? Like, okay, maybe that doesn't make a big difference, right? But if you don't practice expressing disagreement or like having little low-level confrontations, then the big ones are the only ones you're gonna have, and those are always gonna be scary. Okay, moving up. My friend and I are in an argument about methods of raising. How to raise your baby gender-wise. You know, I don't think I'm in a place to tell someone how to raise their child, but I think that ultimately, being accepting of your child being their own person and maybe disagreeing with you is probably good. I don't think you're being an asshole. I think that your perspective is understandable, right? Because unfortunately, every person, we live in a society. I mean, it's true, right? Like, every person gets born into society, and you have to interact with other humans, and you'll have to interact with human concepts like race or gender or whatever, right? Just because something is a social construct doesn't mean it's real. That's like saying that money isn't real because it's a social construct. It's like, okay, yeah, we did make it up, but clearly it's still real and having real effects on people. So that's my feeling, right? Is that you can't opt out of interacting with gender. Being or not being non-binary, being also like being somewhere a non-traditional, let's say, on the gender spectrum, I think is still being on the gender spectrum. Unfortunately, we are all interacting with society and and people's perceptions of us. It's a big part of navigating our identity as people. What are the steps of recovery from a marriage that ended in a divorce because of myself? She still wants to be friends, but I need to give up on the idea of getting back together. I need to stop hating myself and ruining everything. Oof. I'm really sorry that you're going through something really difficult. That sounds really, 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 really hard. I don't think I'm the best person to give you advice on this. Or rather, I don't know that I could give you advice. This genuinely sounds like something that you should see a therapist for. So like someone that you could have a one-on-one conversation over time, you know? It's a lot, sorry. No, it's not that it's like too much, right? It's something I've talked with people about before and totally understandable. It's just not the right venue, unfortunately, and I think I might not be the right person. understandable. I have been seeing someone. That's great. I'm really proud of you. Yeah. I mean, I think ultimately what I will say is it is a really hard position to be in, to still love someone, but the situation that you're in is hurting yourself and hurting them. You know, it's very tough. That's what I'm saying. It's unavoidable, but I want the baby to choose later, not being picked for them before they have a chance to be themselves. I mean, I am going to guess that you and your friend are maybe thinking the same thing, but going about it differently. That maybe what your friend is suggesting is what she thinks is the equivalent of letting them choose later. And I only say this because I have had this conversation before with other people, because I know other people who raise their children similarly, and that was their perspective as well. Okay. I want to do a summary. Thank you, Lexi's Blood Moon Tavern, for the follow. Welcome in. I believe I'm just overthinking everything and letting ADHD rule my brain. I mean, I think it's fair to say, like, your perspective, right? Like, this is where I'm coming from. This is what I feel. These are my concerns, right? And not like, I think you're wrong. Thank you for the first time chat. That's very cute. Okay. So, summarizing, focus on the problem, not the person. There is no, it's not me versus you, it's me and you versus the problem, right? That's my first tip. Ways to tell that you're kind of going away from that is if you're thinking like, I need to win or this person needs to win, someone is going to be right, it's someone's fault. Like once we're talking blame, once we're talking like competition, like this is a fight, then you're beginning to frame it in a way that just leads to making it hard to resolve, right? The second tip, use reflective listening. We are listening to understand, not listening to argue, right? Right? We're not trying to listen for things that we can argue with. We're not trying to listen for things, or even not listen at all and trying to think in our own head about what we're going to say next. It's coming from a stance of you also have a legitimate emotional response to this, a legitimate perspective. This is part of showing that it's me and you versus the problem, right? By reflecting back and trying to show that you understand where they're coming from and what they're feeling, it's a way to act on this idea that we are not actually in direct opposition, right? We just have this friction, we have this conflict that we need to figure out together. And then the last thing we talked about today is using I statements. It's usually better to focus on how you feel and your own perspective instead of making assumptions, because there are going to be assumptions about what the other person is thinking or feeling or doing, right? So warning signs is sentences. If your brain is coming up with sentences that start with you, that's already kind of pointed. And I feel like whenever you start saying you blah 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 blah, they're always going to feel defensive, right? The other warning sign is using like absolutes, always and never, right? You always, you never, I always, I never. I never ask you to do this. I'm always the one doing this. You always leave this to me. You never ask me how I'm feeling. Like, it's so absolute. It doesn't do anything other than make the other person feel unheard, right? There's a reason we say these things, right? Because it's something that we feel inside, but there's probably a feeling a level deeper than that, right? You never listen to me is probably a layer above an I statement that could be like, I feel like you don't care about what I'm saying when you do blah blah blah. And I think that's maybe a more helpful statement, right? Yeah. Oh, shoulds and musts also. Yes. Yes, exactly. Lev, can you make a levology book? Write your own psychology book. Why? Lovely to meet you. Love your model. Very cute and beautiful. Thank you, Lexi. What would this levology book be about? Hmm? What is the levologist book? Guide to be a doctor and a VTuber and a wife in 25 minutes. The art of yapping, yes. Wee wee wee. Wee wee wee. IDK, thought you'd have some points on that. I mean, it's more like what I'm talking about now is not new. Like, these are worksheets and things that exist. Like, I can send it to you guys. Here, I'll put it in the chat. I'll put it in both chats. This is what I'm working off of. And then I'm just talking. I find oftentimes that two people are in conflict and one explain things with more I statements and the other one is like, you did this, they did this. The ones that are saying you and they are usually the ones in the wrong. I think that's fair. I do think, though, while there are often situations where we are in a conflict and someone is right and someone is wrong, I think while you're in the middle of the conflict, you're not actually trying. Well, if you're trying to resolve a conflict, you don't actually need to litigate who's right and who's wrong in that moment. That could come after. Oh, boy wolves, thank you for the follow. And thank you for not scaring the shit out of me today. That's not an invitation to scare the shit out of me. Please don't. Okay, Lev, are psychological studies done in neutral perspectives or in one? I'm not quite sure what you mean. I also, Also, this is the other thing. I don't really do psychological studies. Like, I look at psychological studies, and we learn about them, but you know, I don't really do them. So I'm not quite sure what you mean. I think we try to be as neutral as possible, though. Hindsight is 2020, as they say. Yes. Unfortunately, I have horrible vision. I'm so happy that I could be helpful today. I'm gonna cry. I'm so happy. I love explaining things. I love being helpful. Okay, guys, we're gonna draw the thing, and then we're gonna draw the giveaway, and then I have 2 more draws, or I have 2 more draws today, and then that means I'll have 2 more in general, and those will be all the prints, and then we'll have 2 for the signed mouse pads, and then Seek will be in touch with you guys. Oh, what I mean is, are the studies biased or neutral? Well, I think all studies try to be neutral, but inevitably have biases. Yeah. Have a tomato, thank you. You can thank my therapist. I've been learning to respect people's wishes and not focus on my own. That's actually really sweet. I'm glad that you found your therapist helpful. And that you found that they've maybe changed your perspective a little bit. Okay, in that case, I'm drawing 2 entries. Okay. Studies done by humans have bias. Anything done by humans is bias. Do you give us permission to use the stuff we learned about today to be evil? What? No. Oh. CHAW491, thank you for the follow, and then spraying me in the face. Yep, thanks. Oh my god, I totally did not understand the joke. Yeah, Kimi hindsight is 2020. Okay, yeah, no, I'm gonna drink water. What if I'm evil anyway? You don't have a choice? Well, I mean, you can still be evil. You don't need my permission to be evil. I'm not going to condone evil, but you guys are adults. This is what I always say. As I always say, one of many things I always say. You are adults and you make your own decisions and you're responsible for your own choices. If you are not an adult, you should not be here. I want this mouse pad. Well, that's coming day after tomorrow, I think. Going to isn't doing. Well, I don't have water next to me right now, and I'm gonna have to end stream soon, so sorry. Okay, let's see. No, I'm not gonna draw you. You were drawn, and now you get a print. Sucks I can't be in the stream the rest of the week. Oh, yeah. Maybe I'll do I don't know. I'll figure it out. I'll figure something out. Only an adult in bodily ways, like age or back in the... Honestly, I feel that. Psychiatrist? Yeah, I'm a psychiatrist. Thank you for your first time chat. I am a doctor. For better or for worse. No stolen valor here. I did go to medical school in the United States of America, and I am completing my psychiatry residency this year. You can choose to not believe me. I will not be doxing myself to prove this. I work late and early. I'm going to ask my main manager to switch me to mornings. I kind of like it. Ooh. All right, guys. We need to find someone to raid. Spec? Okay. All right. Let's raid my child. Oh, they're playing Arknights. I guess I should probably play Arknights. Okay. You know I won. Where's my message, bitch? You did message. Yeah, you did win. I have it all recorded. Don't worry. Thanks for sharing some knowledge today. You're welcome. All right, guys. I love you all. Thank you so much for being here. If you are new today, my name is Lev. I am a doctor in real life, and I do a lot of the singing and education streams and cozy games, and I also do a lot of handcrafts. I do sewing and stuff like that. So I do hand cams sometimes. You can check out my VODs on YouTube. I have all of them saved there. I have some covers up that are going, and I have more covers that are going to come soon. Tomorrow we're going to be playing Roadside Research with my friends Arbiter and Peachy, and we are right now going to raid into one of my very good friends, a Spectral Anomaly, who's part of our streaming group, the Digital Dreamers. Everything that you could want is in my socials and my card, and yeah, I have to go. It was so wonderful to meet so many new people today. I'm actually really, really happy to get to see new people. Thank you guys so much for joining me, and have a wonderful, wonderful, wonderful day. Bye-bye. Bye-bye. Bye-bye.